first part of the assessment is you come upon the scene and you make sure that it's safe for you to approach the victim, and you then ask how many people were involved in this activity. How many people were you with when you got hurt?
Just myself.
Just yourself. Okay, so now we know that she's alone. There's no one else that's in danger, and there's no one else to help us. So we alone will help the one victim that is here.
Next, we're going to check the initial assessment. We're going to make sure that she has a pulse, she's breathing, and she's responsive. And we're going to make sure she's not going to die within the next 5 minutes.
The next thing that we check are the symptoms, and by doing this, we follow OPQRST. So the first thing we'll check is onset. How did this happen?
I was hiking and I tripped and fell.
Okay, and then the next step is provocation. This means what position do you feel best?
This one, I don't want to move.
Okay, and then the quality is the next one. So what adjectives would you use to describe your pain?
I have a really strong throbbing in my leg.
Okay, and then the next step is radiating. Is the pain staying in that leg, or do you feel pain other places?
It's just in my leg.
Okay, and then severity, on a scale of 1 to 10, how would you describe your pain?
About a 7.
7, okay. And then time, how long ago did this happen?
Like 10 minutes ago.
Okay.
Next, we will ask the patient if she has any allergies, medications, past history, last meal, and what led up to this event. So, are you allergic to anything?
Yes, I'm allergic to bees.
Okay. And do you take any medications?
Yeah, I have an EpiPen for it.
Okay. Past history with your leg injury?
Yeah, about a year ago I broke it.
Okay, a year ago. Last meal?
2 hours ago about.
And did you also have water?
Yes.
Okay. And when's the last time you went to the bathroom?
Same.
Okay. And then what led up to this event?
I was hiking and I fell, tripped over, and hurt my leg.
Okay.
The next part that we're going to check is her vital signs. We'll first check her pulse and her respiratory. So with the pulse, we're looking for rate, rhythm, quality, and changes in her pulse. And with her respiratory, we're looking for the rate and the sounds. So I'm going to check her pulse on her radial artery. And while I'm checking her pulse, I'm also going to be watching her breathing to make sure that it's normal. I would do this at the same time so that she doesn't change her breathing because I'm checking it. So it's just the way she normally is breathing right now. The next thing we're going to check is her blood pressure. And we're using a blood pressure cuff and a stethoscope, and we recommend to have these in a first aid kit if you want to be able to check blood pressure really accurately. So I'm going to go ahead and check her blood pressure now. Around and through, yeah. My brother married her. Okay, her blood pressure is normal, so there's no problems with that. The next part of checking vital signs is checking their skin. We want to make sure that the color and the temperature and the moisture are all good. So looking at her, the color of her skin is not abnormally flushed or pale, so she looks fine. And the temperature of her skin compared to myself is normal. And moisture, she doesn't seem clammy or sweaty or dry, abnormally dry, so everything is good with her skin. And then the next thing we check is AVPU scale, which is 4 A's, V, P, and U. So if someone were to have A plus O times 4, they would be aware of person, place, time, and events. This is good. That means that they're completely aware of what's going on. As they become less aware of things, they drop down the scale. So if they're A plus O times 3, they're only aware of person, place, and time. And they go further down the scale, they only respond to verbal stimulus, then only painful stimulus, and then if they just have the U, they're unresponsive. And so as we interact with her, do you know your name?
Yes, Ashley.
Do you know where we are?
Yeah, we're outside where I was hiking.
Awesome. Do you know what time it is?
Like noon, because I left around 11 something.
Perfect. And so what events have taken place?
Well, I just.
Next, we'll do the physical exam. So we'll check head to toe, her head. Can I touch her head?
Yes.
So I'm checking to see if there's any cuts or any swelling or bleeding, and nope, there's nothing. Then I'll check her neck to see if there's any swelling or if it's trouble breathing. Does this hurt?
No.
Okay. And then I'll check her chest. And after you check, you can check your hands to make sure there's no blood. Does your chest feel good?
Yes.
And then I'll check her abdomen, and I'll do it by rolling my hand to make sure there's no bumps and make sure it's all good. And then I'll check her pelvis and make sure it's all intact. Tell me if anything hurts.
Nothing hurts.
Okay.
Okay, then the next thing we'll check is her extremities. With this, we're checking to make sure that there's circulation, movement, and feeling. Is that right? Yeah. And so I'm going to go up and down each of her extremities and make sure that there's no problems with any of these. Just let me know if it hurts. Can you feel that fine?
I can feel there's no pain.
Okay. And you go all the way down to the tips of her fingers to make sure everything's okay. So now your other arm. Just let me know if you feel any pain. Okay, all the way to the tips of her fingers. Now we'll check her legs. And just do the same thing, just checking.
This leg is hurting a lot.
Okay, so
Yeah.
but you can feel all the way down to your toes.
I can feel it, but it's
It hurts
a lot of pain.
all
Yes.
over.
Yes.
Okay, so we know that her right leg is in pain. So now we'll check her left leg and do the same thing. Just let me know if you feel any pain.
No pain.
You can feel all the way to your toes though, right?
Yes.
Okay, so we've checked her extremities. Now we're going to check her posterior body, and this is just her back. Make sure her spine's okay and everything's in a line, and there's no problems there. And everything seems to be good with that. So now we know that the problem is located just in her right leg.